Hi, I'm Dawn Morse. I'm the founder of Core Elements Training. At Core Elements Training, we deliver an accredited day CPD course in dry cupping therapy, which is available as face-to-face delivery or live online delivery. In this short video, I'm going to demonstrate dry cupping to the peroneal muscle group and the anterior tibialis. The techniques that I'm going to demonstrate is static cupping and a variation of soft tissue release and active movement to the lateral side of the lower leg. So we're going to start off with applying our massage medium. Okay, so today I'm using lotion, but you could also use oil or wax as well. So whatever you normally use in your manual massage techniques. Okay, so we're going to be a little bit more liberal with the medium application. So I'm going to apply the medium to the whole of that lower leg region. Okay, being a little bit more liberal than you normally would be if you were doing manual massage techniques. Okay, so the medium doesn't need to be fully absorbed before you start applying the cups. So we're using the vacuum cups. Okay, so I'm going to place the cup onto the side of the leg here, and I'm going to put anywhere between 1, 2 or 3 suctions into the cup using the pump. Okay, so as you get nearer to the ankle region, the muscle group turns more into those nice long tendons which come into the foot, and the area gets smaller. So you're going to want to adjust the size of the cups that you're using around that area, getting smaller as you go down. So the tension increases in the tissue as well as you get nearer to the ankle or that lateral malleoli area here. So as we're getting smaller with the muscle tissue, you're going to need to apply more suction in order to get the cup to stick into this area. Okay, so we can see we've got our static cupping on at the moment. So we've literally applied the cups, and what we could do is leave these cups to reduce in their tension whilst we're treating another area of the body, such as the opposing limb. Okay, from here we could then use the static cups to move into soft tissue release. So with soft tissue release, we're using the vacuum to create the lock, but in order to follow the technique, we need to apply the cups when the muscle is in a shortened and relaxed position. So that means that the foot needs to be in a dorsiflex position as we apply the cups, but we need to be holding the foot into this position so the client isn't tensing the muscle group here. So if you relax your leg, excellent. Okay, so I'm going to hold the foot with one hand, and then in order to apply the cups, I'm going to press the pump into the cup so that I can lift the cup up. Okay. How's that tension feeling at the moment? Okay. So you're checking the pressure with the client the whole time. Okay, and then just putting a few more pumps into that smallest cup, which is nearest to the joint. Okay, then from here, we're going to take the foot into plantar flexion and dorsiflexion. At first, the client might not be able to get the full range of motion at the joint, but we're working in small movements first of all, and then into larger movements. So we're moving the foot first into plantar flexion and dorsiflexion. If the cup comes off, which it just has done, okay, from here, take the foot back up again. Okay, and then just reapply that cup. Okay, then from here, once you've moved that ankle joint passively a few times, then you can ask the client then to move into that. So we're now doing soft tissue release, or the cupping variation of soft tissue release in that active motion. Excellent. And then after they've moved that joint anywhere from between 3 to 6 times, that tension in the tissue should start to reduce, and the client should get that larger range of motion, which is what we're looking for. Excellent. We're monitoring the colour inside the cups as well, making sure that those cups aren't going too dark. Okay, excellent. Thank you. Then from here, we can then move that into our sliding technique or our active movement technique. So we're going to slide first and then turn that into active movement. Okay, I've just checked to make sure that there's still a nice amount of medium on the tissue. So I'm going to pop the cup on. I'm just doing 2 sections here. And for sliding around the anterior tibialis and that wider muscle group area, okay, we should be able to move the cup easily using that thumb and that finger. If you really have to yank the cup, then it's too tight. So I'm sliding longitudinally here in the length of that muscle fibre, but then you could also go transversely. If the client is comfortable with that, we can then turn that into our active movement. So now as I'm sliding, I'm asking the client to plantar flex and dorsiflex. If they can't comfortably do that on the couch, then you could just allow that foot to drop off the edge of the couch so that they can move that a little bit more freely. You'll probably find first couple of movements that our cups keeps coming off. If it does, then just reapply it. Okay, and where you feel more tension in the cup, move into those smaller movements until that tension starts to release a little bit. Excellent. Okay, so just as we get nearer to that lateral malleoli area, it gets a little bit tighter in the tissue and it's harder to move. So from there, I'm just going to turn that into a little bit of a frictioning technique by moving that cup up and down. If you want to plantar flex and dorsiflex for me as well. Excellent. Okay, and then once you finish that, we're going to flush that area out with a little bit of effleurage. So making sure that that pressure is being applied through the heel of the hand. Excellent. So that was a quick demonstration of our static cupping to the peroneals and the anterior tibialis. Then a variation of soft tissue release to the anterior tibialis. If we wanted to do soft tissue release more specifically to those peroneal muscle group, then from there we can invert the foot, okay, which is just turning that foot in and then coming out again in that motion. And then we moved into our active movement technique as well. We're sliding as the client is doing dorsiflexion and plantar flexion at that ankle joint. If you'd like to find out more about our accredited day CPD course in dry cupping therapy, then you can visit our website, which is www.coreelements.uk.com, and you can also subscribe to our YouTube channel. Thank you.